Chief Therapeutics is a manual therapy practice for those people who are a little older but who are still active. They come to me, they have some sort of issue, some sort of pain somewhere that's preventing them from really enjoying the activities that they normally enjoy. It's me apart. I've had people come to me who've been told they can't do something anymore and try to work with them to get them to be able to do that again at some level.
I've been to many different practitioners over a lengthy period of time, and Sharon is the only one who's been able to help me.
I'm able to look at a whole person. I'm not just looking at a knee or a foot. I look at it from a mechanical perspective and what's the mechanical issue that's causing this problem. I just try to help anybody who's active who's having a problem be.
Hi, I'm Sharon Sharpe, I'm the Chief Therapeutics, and I'd like to welcome you to my business. We're at 317 North Main Street in Natick in this beautiful building. So go on inside. When a patient comes in, first thing we do is a temperature check. Okay, and it needs to be below 100.4. If it's above that, then we have to reschedule. These are the items that I use for PPE. I wear the mask, I wear the face shield, I have gloves, and I also have a scrub shirt, and I change this, obviously, between every patient. I also have extra masks. Masks are required in the building at all times, so if you don't have one, I can provide you with one. So if you come over here, I'd like to tell you about some of the services I offer. I don't do regular traditional massage. I do lots of different soft tissue mobilization techniques. I'm going to take this off. and have some tools that I use. These are tools for instrument-assisted soft tissue mobilization. Basically, you run it along the skin, and it helps to break up layers of fascia that may be stuck together. I also offer the Aline Insoles, because sometimes you need support on your feet in order to have good balance and in order to take care of problems you may have in your knees, hips, feet. So that's what those are for. And then here I have some cups, and this is for myofascial decompression. So basically, if you haven't seen this before, put this on the skin, and it pulls the tissue up into the cup. And you leave it there for 5 minutes or so. And what it does is it pulls, again, layers of fascia that might be stuck together. It helps to pull them apart. Okay. Also have certifications from the Titleist Performance Institute for golf fitness and the medical level 2 certification, which allows me to look at you from 16 different tests to determine where you may have restrictions of motion that could, number one, affect your golf swing, and number two, cause an injury. So we're able to look at those. If we do find pain, then there's another whole battery of tests to do after that to find out specifically the source of that pain. And it also includes a video of your swing where we can analyze the motion to see how your motion relates to the testing that we did. I'd like to tell you some more about the Aline Insoles, which are used for support of the arches. And these are different from other insoles that you're going to find. If you can see this pattern, this is meant to support your weight throughout the whole weight shift process and not just when you're standing flat. So I actually have someone coming in. I'd like to show you how I fit this. So I'm going to have her step into the device, and we line it up with the second toe in this little groove. Great. Okay, so the first thing that you're going to notice is how the inside of her ankle is extremely close to these poles and the outside is not close at all. So this means that she's pronating. Her feet are rolling in. And this can lead to all kinds of problems in the shins, the knees, and even in the hips. So we have this laser device which shows you a straight line up from that second toe. And you can see, especially on this side, she's nowhere near the center. And we want it to go through the center of her ankle, the center of her knee, and her hip joint. So clearly we have some issues here. All right. So if you could just lift up this heel for me. And put that down. I'm going to shift you over this way just a little bit. Okay, so now we have space. And as you can see, it's going through her knee and straight up to the hip. So that looks pretty good for that side. And I'm just going to take you up one here. So lift up. Okay. All right, so we still have a little issue over here. But we'll see once we actually put the insole on what happens with that. Probably the wrong size for you. Okay, so step out. And now step on those. So we don't have any. Okay, so with the regular straight insole, it's not enough support on this side. Nor on that side. Okay, so step out. To show you a little closer, as you can see, the insole is nice and cushiony. And on the back, I'm going to show you the pattern again. This is the way we weight bear. We land here, the weight rolls off into the inside. This is the inside of your foot. So this is going to support you all the way through the weight shift. Now, to correct the issues that we found, we have these two different clips that go onto the bottom of the A-line. And I think this is what she needs on this foot. And this one on the other foot. You can put these on the inside or the outside of the foot, but for her particular problem, they need to go on the inside. So I'm going to have you step in here again. So, okay, down you go. And just give me about a 5-degree bend in your knees. Okay, so now we're going through the center of our ankle, we're going through the knee, and coming up to the hip. So this should be a good fit for her. Step out. And we have different models of the insole. This one that we fitted for Pat is more for traction, especially if you're doing anything rotary, like a golf swing. We have the yellow ones, which are pretty well padded, which is nice. And these are the blue. These are called the Motivity. These have more padding, and the people who have really kind of severe foot issues find these more helpful. They just have more padding, a little more support. And these are the base model, which has all the same construction without some of the padding. So based on whatever your needs are, we can get you the right insole and the right fit. All right, I would like to show you how I do instrument-assisted soft tissue mobilization, and this is one of the instruments that I use. It has many different beveled edges, depending on the depth of tissue you want to reach and the level of comfort for the patient. And we use this emollient, which is pretty much beeswax, and it basically provides a nice even glide. for the tool. So we're going to treat her calf. Smells good too. Okay, so you're going to let me know if it's too much at any point. Okay, so we just go the length of the muscle. And you can go from bottom to top or from top to bottom, either way. And then sometimes it's best to put a little stretch on that. I'm going to use my leg to put a little stretch on that muscle. And just to get very close to the surface, we do a light stroke. A little warmed up. And then we start to go a little deeper. Still okay?
Great.
All right. Ooh, a little punchy. And you don't do this for very long. If you start to see redness coming up, that means you've brought blood flow to the surface, and it's probably enough. It's not too difficult to bruise somebody with this, so you don't want to be too aggressive. And again, it should not be uncomfortable. And we're just going to follow up with some soft tissue work. So I am certified by Titles Performance Institute to do golf fitness evaluation. So I'd like to show you a little bit of that. It's 16 tests, so we're not going to do the whole thing. So come on in. So we're just going to check on different kinds of range of motion for Pat. And first I want you to stand sideways to the camera. And I'm going to give you a golf club. And just set up before you swing. So I'm looking at her posture, okay? This is nice and straight. What you don't want is this, which is known as an S posture, or that, which is known as a C posture. Both of those things are going to lead to back injury, so this is great. Okay, I'm going to take the club away. You're going to cross your arms in front, go into that same position. So now we're checking rotation of different body segments. So what I want you to do, I want you to keep your upper body still, and you're just going to swivel your hips. Okay, too far, but that's okay. Okay, now that's one test. Now we're going to have you keep your hips stable and just rotate your upper body. Very small motion here. Okay, too far because you're moving your hips. Go a little less. There you go. So what we want to know is, can she rotate those parts separately? And she can. So stand up. So now we're going to check the rotation in her hips. I'm going to give you this. And we put these at a 60-degree angle, which conveniently is the right angle for the head of the 6th iron. So I want you to stand right up next to here, right here. Oh, both feet in there. Yes. Okay, so we're going to work on see what your backswing does for both feet. So I want you to put all your weight, actually most of your weight, on your left foot. So on your right toe. Yep, hands on hips. And now you're going to rotate your body that way. So I'm checking to see if she has enough hip rotation to line up with this angle, and she does. Now your other foot, and rotate through. So this is the downswing. She has enough rotation for that. Okay. So right up here. Now you're going to weight this foot and rotate through. So her hips line up with the line down here. That's good. And your other foot. And rotate. Okay, so this shows she has enough rotation in the hips to go through the full swing. If you don't, then you end up compensating with your upper body. Sometimes you stand up, which is going to mess up your swing. So as I said, I'm not going to go through the whole thing, but these are just some of the tests. There are tests for shoulder, tests for cervical rotation.
But
So
there
I'd
is
like to
one-
thank you very much for coming to see my office and my practice. I'm very glad to have you come by and show you an overview of the different services I provide. Right now I'm having a special on the golf fitness assessment. It's 50% off from now till November 1st. So if that's something that interests you, you want to give me a call, my information will be up on the screen, and get that scheduled before the 1st of November. So again, thank you very much. Any questions? Again, my information is on the screen. Feel free to give me a call or send me an email. Thanks so much. I hope to see you.